Hello everybody, my name is Irene Hibbard and my project was decreasing A1C through insulin pumps and automated insulin delivery systems. My project was collecting data from real patients at my clinical site to determine how effective it is to initiate an insulin pump or upgrade to an automated insulin delivery system. My project goal is to decrease A1C by 0.5% in participants after initiating an insulin pump or upgrading to an automated insulin delivery system. So, an insulin pump is a wearable medical device that supplies a continuous flow of insulin under your skin. It has become a perfect alternative to insulin injections and also still allows boluses for meal times. And then continuous glucose monitors are also attached to the body like an insulin pump, and it allows real-time blood sugar levels at any time and can track changes over time. Automated insulin delivery systems combine both the insulin pump and the CGM, allowing for automated insulin delivery based on real-time glucose data. By continuously adjusting insulin delivery in response to glucose levels, hybrid closed-loop systems aim to optimize glycemic control while minimizing the risk of hypoglycemia. Clinical studies have demonstrated the efficacy and safety of these systems in improving time in range and A1C levels in individuals with type 1 and type 2 diabetes. The picture you see is of a girl named Emmy who was diagnosed with type 1 diabetes and celiac disease. I chose this picture because even though she's going to have a chronic problem for life, she's still smiling and looks happy in the picture. Insulin pumps and continuous glucose monitors make diabetes more manageable so kids like Emmy can live normal lives. This project was to collect data and determine where we can help patients more with their insulin pumps. It ties into nursing outcomes because with the data we can improve patient A1Cs. Together, the insulin pump and CGM make managing diabetes far easier and more effectively, so diabetics can enjoy everyday life. This project aimed to see just how much it helps manage diabetes by doing a before and after A1C. Insulin pumps are already proven to manage diabetes and control glucose levels. So if one of the participants' A1C did not decrease during the study, there must be a reason. That is why this project is useful for a diabetes center, because it shows who needs more help managing their insulin pump, or maybe their A1C level was already low and they just switched to a pump for convenience. Because the next biggest advantage of an insulin pump is how much more convenient it is than giving yourself multiple insulin injections a day. I collected the following data mostly from the electronic health record, Cerner. With this data, I made a large spreadsheet, and at the bottom of the page you can see an example of a row from it. This participant's A1C went from 11.2 to 6.7 after starting an Omnipod 5 pump. With the spreadsheet, you'd be able to see which participants' A1C did not lower and try to target why. Some recommendations for this project would be to obtain how confident a participant is at using the pump and their education level with it. I would also get a larger study group as well. If possible, I would collect A1Cs exactly at 3 months and exactly at 6 months. But that is unachievable due to patients not being able to come at a certain time or being unavailable that day. I would also want data related to if the participant has met with a dietitian or gotten a diet plan or if they have a normal exercise routine. The last recommendation would be to monitor the changes of patients' basal rates on their insulin pump. A participant's basal rate may need to be constantly changed if blood sugar levels are not managed well. Overall, this project was a success because I was able to get some feedback from the data I collected. The most important statistic was that 24 of the 36 participants, that's 66.6%, lowered the A1C by at least 0.5% within 3 months of starting a pump or an automated insulin delivery system. This is a promising statistic, although I would have liked a larger group size than 36. I had 61 total participants, but I was unable to get a second A1C for all of them because Cerner was not available because Ascension was cyber-attacked. I also think it would be beneficial for the 6-month A1C draw, because in theory their A1C would even be lower after 6 months of use. If it is not, then something is wrong. The biggest barrier I had was the cyber attack, which halted a lot of my data collection for me because the electronic health record Cerner was down. Even though it was down, I had to use what I could. The most important lesson was being able to share my results and learn from them. I was even able to meet with some of the participants and talk to them about how their A1C went down or ask why they think it went up. I think projects like this are important to any health center because it can help target what is being done right and wrong. And if something is being done wrong, search for the problem and fix it. I know this is hard to see because it's in such small font, but this is the table I made for participants initiating an insulin pump, and that was as big as I could make it without cutting anything off. And this slide was participants who upgraded to an automated insulin delivery system. With this spreadsheet and the one on the previous slide, that was the total 61 patients. And here are my references that I used to complete my project. But most of my project was spent collecting data from Cerner.